Hello everybody. Today's edition of Ask the Expert will deal with a very important topic, and that's the topic of injury prevention and injury treatment. And our expert today is Dr. Phillip Bauman. He's been an orthopedic surgeon for more than 30 years, and more than 25 of these years he has been affiliated with American Ballet Theater and New York City Ballet, and also with the affiliated schools. So he knows everything there is to know about dancer injuries and beyond. Thank you so much for taking the time to talk to us today. Thank you, Dr. Bauman.
Thank you for inviting me.
So first things first, what types of injuries do dancers sustain more often, and how do you recognize them?
Dancers frequently sustain ankle and foot injuries, and especially in dance, students' foot injuries can be problematic. We tend to focus on the acute injuries, such as the common ankle sprains, but an equally important area of injury are chronic injuries, which are stress-related injuries, including stress reactions and stress fractures of the bones in the foot. Most common of those is a metatarsal stress fracture, which typically occurs gradually, often very insidious or asymptomatic without significant symptoms and pain, and then over time becomes much more painful to the point where a dance student or a dancer has difficulty performing releves, jumping, or being on point.
So right away, dancers should know the difference between acute trauma and trauma that accumulates, until it becomes sort of so, it reaches a critical mass of trauma, right? Like, so the stress reaction, it starts with how do you recognize that and how do you hopefully anticipate it before it becomes a real issue?
Mm-hmm. That's a great question. The way to recognize it typically is by recognizing that there is pain that's unusual or different, a different pain pattern. And again, because it can often be subtle and it will not necessarily be painful all the time, but just during certain activities, certain parts of class, it may be deceiving and one may think that it's something that just can be worked through. But when the pain persists after a period of time, if it's something that's experienced on a regular basis during parts of class or is worsening in magnitude, that's a point when one should consult a specialist and consider other treatment.
So you're looking for unusual pain, because pain is part of a dancer's life anyway, right?
Yes.
You might say you're always stretching your body to the limit. So what parts of the body are you talking about in terms of pain, and what pain is unusual enough to be unusual? How do you know?
Yeah, well, it's subjective in the end, and some dancers have a very high tolerance, and they actually don't really feel the pain that may be associated with a bone injury, such as a stress fracture, or other injuries that occur gradually in onset, such as a tendon problem that can result or cause tendinitis, or even sometimes injuries to the cartilage in the knee can appear slowly as opposed to rapidly. So there's always, I think, for these more chronic, slower onset problems, difficulty in recognizing them. But when the pain is recurrent and persists, one should think that it needs to be treated. Not the pain that you might feel when you're warming up that goes away, but the pain then that lingers, the pain that increases in its intensity, even if it's subtle. One can dance through pain to some degree, and as you mentioned, dancers are used to experiencing pain. But when it's a different pattern, different location, then one should be more concerned and seek treatment.
So in some ways, you have to think of pain as your friend, as your messenger that signals to you what part of the body you should pay attention to.
Yes, that's very accurate, and that's a very good point. Many people will treat pain by taking pain medication, which makes the pain less apparent, but
and less useful to you.
Less useful. So pain is, in fact, your friend in recognizing that there may be a problem. And it's hard when you're starting out or you're doing new things in terms of dance class, perhaps you're doing neuro movements. It's difficult sometimes to assess what you should be experiencing, but if the pain persists or it recurs, that's a warning sign.
Or gets worse.
It gets worse.
So stress reaction and stress fracture, what's meant by that is that when you put a certain body part through repeated, I guess, stress, right? When you pressure or work that it's not used to doing, it then cracks or breaks. What happens?
That's a very good explanation. So stress fractures in the metatarsals in particular, which are more common in dance than in other bones, have been recognized for literally centuries, and in fact were described as in the infantry were described as marchers' fractures because they occurred in the same bone in the metatarsals in the infantry who would walk 20 miles or more in a day when those same infantry were not used to walking those kinds of distances. So the idea behind a stress injury is that when you repeatedly stress your body, or in this case the metatarsal, to a degree that it's not accustomed to, you are subjecting it to an abnormal amount of stress, and it will result or be more likely to result in either a stress reaction or stress fracture. In regard to dance and ballet, the second metatarsal is the most common bone in the foot to experience abnormal amounts of stresses, in part because it's a little thinner bone than the larger metatarsal that is associated with the great toe, and also when you are dancing, even with simple releves, you're putting far more stress and pressure on the second metatarsal than the others. So it's the one that is more likely to see the additional stress, and when you try to increase rapidly, you're much more likely to have problems.
So the first and second metatarsal are the most common areas which are susceptible to trauma in dancers. What other parts of the dancer's body do you see as susceptible to stress-related traumas?
Well, actually, the second metatarsal, not the first metatarsal, is most likely to be subject to stress injury because of the relative thinness of the bone compared to the first metatarsal. But other parts of the foot first, which can be subject to stress injuries, are some small bones under the big toe called sesamoids. And we can see stress injuries in the same fashion in these little bones, also associated with jumping or with repeated releves in some dancers. In other areas of the body, I would say that the next most common area or bone to experience stress injuries are tibia, which are the lower leg bone between the knee and the ankle. Tibial stress reactions and stress fractures typically occur associated with higher impact types of class, which means specifically jumping. And so if a dancer who has been off and not taking class for a period of time, or even a young professional has been off and then all of a sudden returns to a very heavy load and schedule of classes, including jumps, is more likely to develop a stress injury to the tibia in that setting.
So your advice would be to be really aware of that and just to gradually go back.
Yeah, it's always a good idea to prepare your body for either a school year or an intense summer session. And I always advise dance students not to take several weeks off and then go back into a very heavy schedule, but to gradually increase the load and actually take classes even in their off period. Which is not to say that they shouldn't have rest periods. I think especially in the young dancer, it's very important to have periods where your body can heal and can also grow safely, so that you need to have periods of rest interposed between heavier periods of load. Returning to the stress injury in the tibia, those typically also present, which is to say what a young dancer may feel is pain usually in the middle portion of the lower leg on what's often referred to as the shin bone. And again, the pain can be subtle. It may start out as a very mild discomfort that they feel only when they're doing heavier impact, bigger jumps, and then over a period of time becomes more consistent and more regular. It's not a type of pain that often will restrict a dancer from taking class. And so once again, it's one of those symptoms that can be subtle and deceptive and present slowly, but you have to recognize it when it's been there for a period of time, and when it seems to be either increasing in terms of the amount of pain or just not improving and resolving.
So the first takeaway already is that dancers should get in the habit of listening to their bodies, and specifically listening to pain as the signal that lets them know whether they should go to see a doctor or pay attention, or maybe like lessen the load on a certain body part.
Yes, that's very important. Recognizing and listening to your body is critical to stay healthy.
So these are stress-related injuries, as in injuries that accumulate over time from repeated pressure or load that you put on the bones, let's say. What are some of the traumas that a dancer, or some of the most frequent traumas that you've encountered that dancers, especially young dancers, can sustain in class? And how do you recognize them? What are the different types, and how do you know what they are?
Yeah. I would say that the most common acute injury in a young dancer is a sprain of the ankle, and they often, not always, are associated with weakness of some of the muscles around the ankle. So in terms, first may I just speak about prevention. In terms of preventing these types of injuries, it is critical to always be in shape. And conditioning is something that is more than simply taking class and doing bar. It often involves doing other specific exercises, which we can talk about later. But when an ankle sprain occurs, usually the ankle is twisted in a fashion. It's typically very obvious. Many times the dance student or the dancer may not be able to bear weight after the injury occurs. Sometimes the pain acutely, when it is occurring at the instant, is severe enough that they're unable to stand following the injury and they fall to the ground.
So that's a sign that you twisted your ankle. And sometimes does it get swollen? Does it not? Does it matter?
It often does swell, but not always. And one cannot be deceived by the swelling immediately.
The lack of swelling.
Because often the swelling occurs in the following 24 hours. It doesn't necessarily occur immediately. So again, pain should be a guide. You should use pain as a guide in the sense that if it hurts to stand after an injury to the ankle, one should not be standing, one should seek help. You don't want to try to push through it and continue in class or continue in rehearsal or performance, because you may worsen the injury significantly.
So if you think you've sprained your ankle, stop dancing. Stop walking on it. What else? Do we ice? What do we do?
Yeah. Well, normally at most dance schools and in most situations and settings where a dancer might sprain an ankle in class or in a studio, there'll be other people around who can help. But you should certainly ask for help. Don't be stoic and try to tough it out. Ice is one of the first treatments we recommend for any type of injury, be it ankle or knee injury.
And why is that?
And ice is very helpful as to control swelling, and also is very helpful in controlling the pain that may be associated with the injury. So typically ice is available at many studios, and people generally recommend using ice up to 15 minutes per hour in the initial injury over the first day or so. I think it's important if the student or the dancer has pain that is debilitating enough to prevent them from walking normally, that they seek medical attention. So I think the next step after the initial immediate treatment of doing that, and perhaps if either crutches or some sort of external support are available, to use that, or ask for help from a fellow student or from a teacher.
So ankle sprains. What other common traumas can a dance student encounter in class?
In the ankle and foot area, one can also at the same time concomitantly sustain a fracture of a bone on the outside of the foot called the fifth metatarsal. There are different types of fracture patterns in these bones, and they're almost always associated with the same mechanism of injury. That is to say, one can twist one's ankle and also sustain a fracture of this bone. Most of these fractures heal without other intervention than restricting activities and immobilization. Some of them require other treatment, including occasionally surgery. These fractures typically are painful and cause symptoms immediately. They aren't always associated with ankle sprains, so they can occur as an isolated event. And if you have a twisting episode and your ankle isn't bothering you, yet you still have pain on the outside border of your foot, it's, again,
You might have fractured.
a reason to seek medical help.
Okay, so what we're trying to get at is like, here are some warning signs, guys. You know, if you feel this, do this. So what other types of injuries should dancers kind of be aware of and be on the lookout for?
The next area that is relatively common in injuries are knee injuries. The knee is not quite as frequently injured as foot or ankle. Knee injuries vary tremendously. Some of the injuries about the knee can be chronic injuries, such as a tendonitis, which occurs, again, in an analogous situation to a metatarsal fracture or metatarsal stress reaction. One can overstrain a tendon, and then repetitive straining and stress on the tendon can often lead to tendonitis. So that typically also will present with pain. Again, it may not be a specific injury where someone takes a fall or spill or twists the extremity, but rather just a gradual onset. Patella tendonitis is one of the more common tendons and types of tendonitis that occur around the knee, but other tendons also can be involved. In addition to tendon injuries, there are the injuries that occur after twists of the knee, perhaps again associated but not always associated with a fall. The most common of those is the cartilage, or what is referred to in medical terms as the meniscus, which can be strained or can tear, and often will present with a sharp pain, typically associated with a twisting injury in a young, otherwise healthy dancer. Sometimes they can present more subtly over time, just with swelling and pain that's localized to one side of the knee joint.
And so again, you're looking for unusual pain activity, right? And that's how you know these things.
Yeah.
Well, we haven't talked about the spine at all. Are there certain traumas of the spine that dancers should know how to recognize and look out for?
Yes. In fact, dancers are also, especially younger dancers, are subject to stress injuries in the lower spine, in the what we call the lumbar spine, which is just above the sacrum and the pelvic bone area. The most common stress injury is referred to as it's a complicated name. It's called a spondylolysis, but it's essentially a stress fracture of the vertebra. These typically occur from repetitive stress that can occur with arabesques or with arching of the back, such as cambray backward, but mostly associated with jumping, and when landing, if landing improperly, or if the mechanics and the structure and the alignment of the individual dancer is such that they're predisposed to having an abnormal amount of stress on this area, a stress fracture or stress reaction can ensue. Again, the presentation...
How is it different from regular back pain?
Yeah, so the presentation of a stress fracture, it can often also be very elusive and difficult for a dancer, young or old, because it doesn't necessarily present with severe incapacitating pain. Sometimes back problems will present that way, say, with a male dancer partnering and perhaps partnering incorrectly, or something goes wrong during the partnering, and they'll feel a very sudden sharp pain or spasm and be unable to move. Stress injuries to the lower back and spine can be very subtle, and in the beginning can present as a very dull, kind of nondescript aching pain that they can't necessarily even define. That is to say, it's hard to localize it. Over time, the classic presentation in the dancer in ballet is that pain is associated repeatedly with arabesque. And when that happens repeatedly and does not seem to resolve, it is time to seek medical attention.
So if it hurts every time you do an arabesque, you go to a doctor. And how do you diagnose? Does the doctor, is it an X-ray situation? Is it something that a doctor can just tell by looking at you and asking where it hurts?
Stress injuries to the bone can be difficult to diagnose initially. X-rays are certainly the first line of evaluation in terms of images and imaging type studies. We use MRIs often to define early injuries to the bone because they may be invisible on a plain X-ray. And that's true not only for injuries, stress injuries to the spine, but stress injuries to the tibia or to the metatarsals are treated the same way. X-rays typically will show changes in the bone if there's been a stress fracture present for a prolonged period. In other words, a month or longer, but often early on, they will look normal. So it's also important not to be misled into thinking if you see a doctor and you're told the x-rays look fine, while that may be a good sign, it's worthwhile if you continue to experience pain to have additional studies such as an MRI.
Right, because you can see certain things on MRI that you wouldn't be able to see necessarily on an X-ray.
Correct. Yeah.
Right. And so, right, because that's always the question is like, when do you keep going in terms of trying to find out what's wrong with you, and when does it become hypochondria, and when is it like, so what we're looking for here is really kind of like, guys, don't miss this, here's the most common mistake that you make when you think it's this, but actually it's that. Do you have some of that advice for dancers that you often see?
Yes, it's always difficult, especially for the student or the dancer who's never had an injury, to understand when they need to seek help. And you, on the one hand, don't want to be asking for medical help with some minor problems that are often very common and don't require any specific treatment. But I would tell all dancers that it would be better, if you're wondering if this pain is normal, to see someone, a healthcare provider, perhaps a physical therapist who may be affiliated with a company or a school, or a doctor if there's persistent pain. I think you're better off doing that, at least in the beginning. And if you're relatively new to dance, you may not really understand what is the normal amount of pain to experience, but be open, be willing to ask questions, and be aware.
So listen to your body. Pain is your friend. Listen to the messages that pain is delivering. And if in doubt, better to check than to tough it out, because there is a point beyond which you can actually let it go too far, right?
Yes.
Some conditions.
Yes, if in doubt, check it out.
If in doubt, check it out. That's a great one. So that's in terms of traumas that are sometimes chronic, sometimes acute. So that's in terms of dealing with the traumas when they have happened. What could you tell us about injury prevention? How do we make sure that traumas don't happen? Mm-hmm. What can we do?
Well, in the companies I've been consulting for, American Ballet Theater and New York City Ballet, over the last several years, we've begun to focus on injury prevention to a much greater degree. And similar to other high-level athletes in sports, we realize it's very important to prepare your body for dance. And that isn't simply that you need to take class or that you need to take bar or that you need to warm up. There are various prevention programs that we have begun to focus on that involve training, conditioning. Much of it relates to strength, but also to flexibility. And it really needs to be tailored to the individual dancer. So some dancers may have a weak upper body and need to focus on strengthening and conditioning of their upper bodies, especially in young men who may not have full strength or the strength that they need to partner.
And to lift
correctly. It's critical to work on upper body strengthening. And conversely, it may be important to work on lower body strengthening just to be able to have adequate strength for jumping.
So what you're saying is that one of the best things a dancer can do to prevent injury is to train outside of class.
Yes, and in fact, not only in dance, but in other sports, and especially in young athletes and dancers, we recognize that focusing only on that area, be it you're a dancer or you're a baseball player, and not considering strength training and other types of conditioning will be detrimental and will increase the likelihood that you'll have injuries.
So what are some of the types of cross-training? We will have a whole separate episode of Ask the Expert. We'll have some great experts talking about cross-training. But if you could just name certain types of training that you would recommend as a doctor for dancers to prevent injuries.
Well, I think ideally if you have the opportunity and have someone available who does work with a dance studio or company, take advantage of their expertise. And these sometimes there are certified trainers. Pilates is a very popular tool for young and older dancers to work on core strengthening, work on general body conditioning. I think that would be a great tool to use in terms of conditioning, but not necessarily the only tool one would use. Sometimes more conventional types of strength training that involve using weights are important for upper body strengthening, for being able to lift.
Especially for men, going to the gym and just doing strength training.
Yeah, absolutely. And even for women, depending upon the situation. So it needs to be individualized and tailored to the dancer, and one really ideally would have an assessment by an expert to be able to be given advice for how best to strengthen and what areas to focus on.
What else should dancers consider to try to live a long life in the art?
Another very important and I think an area that is addressed, but I think inadequately addressed still, is proper diet.
Right.
And this is true in all forms of physical activity. I think we are now paying more attention to proper diet and what that means in many different areas. It's not simply about caloric intake and how many calories you take, but it's about the balance of what type of food you use and that you take and that you use to burn and to fuel your body. So it's very important to have adequate protein in your diet. It's very important even to have adequate fats in your diet. And we often think of fats as being bad for your body and that it will cause you to gain weight, but that is absolutely not the case.
So fat actually is important not only because it gives food to your brain, but also sustains your arteries. Isn't that right?
Absolutely. It's a very important source of energy, and especially in growing bodies. There are other areas which are also important and sometimes overlooked. Simple things. For example, many dancers have inadequate dairy product intake, and that means that they have inadequate calcium intake. And especially for the growing dancer, it is critical for bone health to have adequate calcium intake. So that's an area to focus on. Sometimes that requires some help and advice from your pediatrician or your doctor. Vitamin D intake, I think, is also underemphasized, and while many people will take foods or ingest foods that have vitamin D within them, such as most milk is supplemented with vitamin D.
Do you recommend supplements, like actual supplements, vitamin D supplements?
Yes, yeah. Most people who live in the modern technology and life world that we live in, and certainly dancers who live in studios all day, aren't exposed to sunlight, which is necessary for our own bodies to actually produce vitamin D. Vitamin D is an essential part of bone health. And
is the vitamin D in the capsule forms the same thing as what you get from the sun, or is it just as effective?
Yeah, so the vitamin D that you take in orally in a capsule or supplement is the same vitamin D that you produce. However, your absorption is different, so that different individuals, different dancers, different people absorb vitamin D that they may take in as a capsule or as a food, as part of a food at different rates. And so some people may not absorb vitamin D very well and will need more. So the average vitamin D recommendation isn't necessarily adequate for the dancer or for any athlete. And so for bone health, it's really important to check that as well.
So really what you're saying is that each individual dancer must kind of take the time and make the effort to learn what their body needs and supplement it both in terms of nutrition and in terms of exercise that they specifically need to lead a healthy life as an artist.
Very well put.
Okay. So is there any other advice that you think young dancers should know from a doctor's standpoint?
I think balance in life is key at all stages of growth and development, whether you're a young dancer starting out or you're a professional who's been performing on stage for 20 years. One needs to balance what you do, and to become too focused in dance and not have other areas, for example, with your health and strength, to avoid going to the gym or working out and doing strength training, I think is an error. One other area, in part, I think that we fail to address adequately in our society, and it's not simply in dance, and it's very simple and obvious, but is adequate sleep. In our society today, I think we tend to try to do more and more, and it puts pressures on us. And if the student who has is being pulled in many different directions, whether it's in class, ballet class, or perhaps in a conventional class. It's hard to find time, and you're often pressured to push it and not get adequate sleep. But this is also very important for your body in terms of healing, but also in terms of growth.
Well, in fact, it's important for your brain, it's important for toxin reduction, it's important for everything. So your body, basically, if you think about it, your body is your instrument, and your instrument needs maintenance, and it happens during sleep.
Absolutely correct.
So sleep is very important. Well, there's only one last question that I'll ask you, and actually for this, I'll ask you to do something unusual. So if you can imagine yourself as your teenage self, what do you know now that you wish your teenage self could know back then? And so this camera right there, this is your teenage self. So if you could please give your teenage self some advice.
In addition to what I've said, and I must say that I am as guilty as many of my patients in not following
well, so
the
first
advice.
You would want your teenage self to know that you're now a doctor, right?
Exactly. My teenage self, I would say, as a doctor, I would say take better care of yourself. And I think we've reviewed a lot of the elements needed to do that, but taking care, including adequate sleep, adequate diet, and also being interested in other things than simply one area in every capacity. I think most importantly, follow your passion. It's so important that you develop something that you love, and obviously to the people I'm speaking, the dancers, they are passionate about dance. It's important to pursue it to the ends and to the limits of your ability, but just remember that everything in life should be balanced.
Our expert today was Dr. Phillip Bauman, an orthopedic surgeon with more than 30 years of experience, more than 25 of which was devoted to New York City Ballet and American Ballet Theater, where he serves as orthopedic consultant. I'm Sergey Gordeev, and we'll see you again on Ask the Expert.